to Medicare for 2025. So it's important that you know about it so you don't lose money, you don't lose benefits, and perhaps we can save you some money. If you're new to my channel, my name is Ed Weir. I'm a former manager of the Social Security Administration. I've helped millions of people throughout the country make sure they're getting everything they can from Medicare, Social Security, disability, retirement benefits, spouse benefits, survivor benefits, all the rest of it. And this is what I'm doing in my semi-retirement, is helping you all make sure you're getting everything you're entitled to. And if you're about to file, let's make sure you're doing it correctly. Social Security is not forgiving in terms of getting a do-over if you make a wrong decision. So, all right, this is also a live Q&A. I'm going to talk about the 7 big changes for 2025 for Medicare, and that should take about 15 minutes. And then I'm going to open it up to all of your questions. I see a bunch of questions already in there, and even got someone became a gold member, Mike Chandler. Hey, Mike, thank you very much for the support. I appreciate it. All right, so let's get right into it and stop the stalling and get right in to make sure you're getting everything you're eligible for. All right, so big changes for 2025. Number one, is, you probably already heard about this one, is the $2,000 out-of-pocket max for prescriptions. Up until now, this year, it's about $8,000, and for 2025, it's $2,000. So the max you can pay out of your own pocket is $2,000 for prescriptions. So that is going to help a lot of people out in the future. Unfortunately, there's some negative consequences to that. We'll get into that, but $2,000 max out of pocket is a big deal for a lot of people that pay way too much for their prescriptions in the first place and have quite a few prescriptions that they have to pay for. Number two is the infamous donut hole. That is finally 100% gone. The $2,000 max prescription cost out of pocket, that's kind of replaced that. It's kind of this year in 2024, it's a little bit of both, but the donut hole is finally gone. And there's added another thing. It's called payment smoothing. A lot of people that have high prescription costs, they usually have high prescription costs in the first part of the year. And because, that's when they finally meet their max, and for the rest of the year, they don't pay it. But for the first several months of the year, they have to pay that $2,000, or up until now, the $8,000. But they've come up with a new plan. It's called payment smoothing. So rather than have to pay that, reach that 2,000 cap the first month or 2 months, a lot of people do, unfortunately, they can smooth it out as kind of a payment plan. So make sure you contact your Medicare Advantage plan if your Part D comes from your Medicare Advantage, or you contact your standalone prescription drug plan and say, hey, 2,000 cap is awesome, but I have to pay that the first month. Or is any way I can smooth it out for the entire 12 months, and they can set you up on a payment plan. So that's pretty awesome. Number three, weight loss drugs. Medicare has traditionally never covered weight loss drugs, but Ozempic and all these other drugs designed for type 2 diabetes and cardiovascular issues and stuff like that. And they also have the positive side effects of essentially being a weight loss drug. So Medicare is now covering these drugs, but you can't get it specifically as a prescription for weight loss. But if you have type 2 diabetes and cardiovascular issue, and part of that is because of a weight issue, then guess what? It is now covered. So 2025, this is going to be music to a lot of people's ears out there for 2025. So immediately, make sure you sign up for a plan coming up in the annual enrollment period, which the new plans come out in October, and you can change your plan effective October 15th to December 7th. And I'll show you how you can do that. And we'll talk about that a little bit more here soon. All right, another thing's happening. Mid-year statement from your Medicare Advantage plan. So CMS, the Center for Medicare and Medicaid Services, essentially Medicare, pays these Medicare Advantage plans to provide these services to you. And some of these plans have said, okay, we'll also provide dental and vision and hearing and all this gym membership and all that kind of stuff. So the government has kind of paid them for these kind of extra benefits as well. But a lot of people haven't been using them. And so the government is saying, okay, why aren't people using these dental benefits and gym membership and all this other kind of stuff you're giving them? Are you making it too difficult for them to, access these services? Are just not good? Are you not making them aware that they have these services? So that changes in 2025. In the mid part of the year, you're going to receive a letter from your Medicare Advantage plan, and it's going to say, hey, by the way, Bob, you have $3,000 of dental benefits, and we noticed you didn't use it. You realize you have that. Sometimes, Medicare insurance agents sign you up, they tell you, and you forget about it, or they don't tell you, and you don't know about it. And so you're losing all these benefits. And so the Medicare Advantage companies are now obligated starting 2025 to kind of send you a reminder. Because as I always say, if you're a regular viewer to this channel, these companies are not giving you these benefit, these extra things because they're so awesome and all that. No, they're companies, they're out for a profit. This is your money. That company has your money. All that money you paid into FICA, all those decades, that 1.45% you paid into Medicare, the Social Security FICA tax, and your employer pays the other 1.45%, unless you're self-employed and you pay both. But all that money you sent over the last many decades, that's sitting in Washington. And when you sign up for a Medicare Advantage plan, XYZ company, they take their little begging bowl and they go to Washington and they say, hey, give me, Gordon, Mike's money. And that the government gives them that money. So that's essentially your money. So get your money back from those big billion-dollar companies. The CEO will have to buy one less yacht next year if you go get your money. So that's, I'm sure we're all crying tears for the CEO. All right, number 5. Changes to your Part D plan or Medicare Advantage plan. So if you have a Medicare supplement, plan N or G or F, that means you have a separate Part D prescription drug plan. If you don't, then you're going to be penalized 1% for every month you didn't. A lot of people out there, unfortunately, again, the Medicare insurance agent or broker that signed them up for a Medicare supplement and failed to sign them up for a Part D. And yeah, they're going to be penalized for the rest of their life once they sign up. A lot of people not doing the right things out there. So anyway, but if you have a standalone Part D or a Medicare Advantage plan, tons of changes for 2025. Why? Because again, these companies are in it for a profit. Now they can't charge people more than $2,000 for prescriptions. People are going to start using their extra benefits, their dental and vision, because now they know about them. Medicare is starting to pay these companies less. And so the Medicare insurance companies that run these Part D and Medicare Advantage plans, they're looking to squeeze out every dime they possibly can. So the plans in 2025, just don't look at the plan and say, hey, it's still zero premium, because they're not going to change the zero premium part, because they might go back to charging a premium in the future, but right now it looks like zero premium is pretty much here to stay for most people. They're not going to, they might change your doctor or something like that, but just don't look at those two things. Look at all the details under the hood. How much for if you go to a hospital. Last year it might have been $100. Now next year it's going to be $500 a night when you go to a hospital. MRI was $50 last year. It's going to be $300 next year. CAT scan was this. Doctor specialist is this. All. So you have to look at your annual notice of change, which you should have already received already, and it gives you all of the gory details for your 2025 plan. Because your current plan, if you don't do anything, your current plan just automatically renews for 2025, and you're stuck with whatever changes they made, because your current plan expires December 31st, and you get essentially a new plan. You get the same card, you'll keep the same card and all that kind of stuff, but everything under the hood just might change. So it's really, really important. And because of that, and because of all the people not doing the correct job out there, old Marine Corps sergeant of me, if you can't do it and other people can't do it right, just do it yourself type stuff. So I put together my own Medicare team that can help you out. All you got to do is click on that little QR code and fill out a little form, and we can help you out when the new plans come out. I'll put up my phone number and email address here in a little bit as well once we finish the rest of these. All right, number 6 expanded program for family caregiver services. This is particularly for those helping assisting relatives who have dementia. There's a brand new system that the Medicare has come out there to help those people helping their relatives with dementia in terms of respite care, some training, other type of benefits to help you make your life easier, because taking care of someone with Alzheimer's dementia is obviously very taxing. So there's a lot of details on this. You have to have, be taking care of someone who's on Medicare with dementia. They can't be in a nursing home or skilled facility. You're basically taking care of them at home or their home. A lot of details on that, and there's areas throughout the country that have more resources than other areas. But once I finish here today, finish all the live Q&As, I'm going to put the links in the description. So just click those and you can find out for more information. But yes, it's that information, that those resources are going to be available, and they're expanding even more in 2025 as time goes by. Number 7 is more mental health providers. So a lot more focus on mental health. That all kind of began with the Affordable Care Act, that mental health treated as same as physical health. So that's moving over to Medicare finally. And traditionally, family therapists, mental health counselors, addiction counselors couldn't take Medicare. Now they are. And so you see a lot of these therapists and counselors throughout the United States signing up to take Medicare. So make sure you reach out to your therapist and say, hey, I heard you might start taking Medicare pretty soon. And if you have a Medicare Advantage, then obviously you have to go through their networks or pay more. All right, so those are the 7. I always like to go through the topic of the day relatively quickly so I can get to your specific questions, because if you're a regular viewer, with Social Security, over 20,000 pages of policy, there's exceptions to the exceptions. So let's see if we can help you get everything you're entitled to. So yes, Mike Chandler became a gold member. You are too awesome. I appreciate it. Thank you. Thank you so much for the support. All right, let's see. Happy weekend, Dr. Ed. Loved one, thank you for all you do. You're welcome. You're welcome. Thank you. Penelope, I heard on another channel that they may raise to the death penance from 255 to 2,900. Have you heard anything about that? No, I haven't heard anything about that. Yeah, there's been 255s for decades. I've issued hundreds of thousands of those checks when I worked at Social Security, and that was always depressing. So it's like I can't even buy half of the flowers for a funeral. It's terrible. So I wish they would change it. But anyways. Love your mission here. I filed at 62 and my spouse also filed at 65, passes away. Do I get 100% of survivor benefits? It depends on how old you are right now. If you get survivor benefits early, then anytime you get benefits early from Social Security Administration, for the most part, it's reduced. Retirement, spouse benefits, survivor benefits, they're reduced when you get it early in terms of your full retirement age. So it really depends on your age. And survivor benefits, there's all kinds of strange kind of moving parts for survivor benefits. Again, when you file, but also when the deceased spouse filed. Did they file early? Did they file late? After, not late, but after their full retirement age? Did they file at their full retirement age? Did they file at all? Were they receiving disability benefits? So that factors all into the amount you will get. If they filed pretty much at their full retirement age or were receiving disability benefits, you'll get 100% of what they were receiving if you waited till your full retirement age to start those benefits. Jim, I'm having a trouble finding a place to calculate future benefits if I start collecting at 62 and keep working, replacing some 0 years. I know it'll get reduced benefits collecting at 62. Thanks. Yeah, SSA.gov. Don't go out there and pay some company $400 or $500. A lot of companies out there that take your money and run the stats, and they've always been wrong. So it's even I don't do manual calculations. I help people, individually who schedule an appointment, but even I don't do manual because you don't have the entire work history. Who does? Social Security Administration. So go into ssa.gov. You'll see your work earnings record there for all those years, and you can go in there and manually add years. And Social Security already does that. When you see your online statement through ssa.gov, you set up the account and everything. If you're like 55 years old, you'll see how much you would receive at 62 and your full retirement age and all that kind of stuff. And you're like, how do they know that? Well, they based it on your earnings up until that time, and then they also project future earnings based on your recent earnings. So if you're making basically $50,000, they, for the next, 12 years, if you're 55 or whatever, 50, they kind of stick in $50,000 and, kind of play around with inflation rate or something like that, COLA increases, and they just kind of guesstimate. So the farther you are away from 62 for retirement age, the less accurate it is because there's more future projections in there because your earnings could go up or go down. But if you look at your statement when you're, 66 years old, it's, yeah, very, very, very accurate. If your work history is accurate, that's the most important thing. As I tell people all the time, check your work history. And please, young people, tell those young people around you, um, 20s and 30s, don't put away your taxes when you finish your taxes. The last step in doing your taxes is going to Social Security SSA.gov a few weeks after and make sure those earnings that you paid taxes on, FICA taxes on, make it to Social Security because you file for those taxes. You notify the IRS, and the IRS notifies Social Security. Somewhere along the lines, if something misses, then 20, 30, 40, 50 years later, you're going to get the wrong benefits for the rest of your life and you might not be able to fix it. So make sure, yeah, sit those people down around you and say, did you do your taxes? Yeah, I did my taxes. Did you do that last step? What last step? Check your Social Security record. Yeah. On survivor benefits, do they go toward earnings limit if I'm concurrently working? Or is that just for income taxes that it's looked at as earnings? No, it's yes. No, yes. Earnings before your full retirement age count against survivor benefits, spouse benefits, retirement benefits. Disability is a different thing. But yes, survivor benefits, if you're working this year and making over $22,320, then Social Security holds back $1 for every $2 you go over. The year you hit your full retirement age, that changes pretty much triple the amount, and they hold back $1 for every $3 you go over. So yes, that is another factor. People ask me all the time, when should I file for retirement benefits or spouse benefits or survivor benefits? Well, all kinds of variables. Do you need the money? Tax is going to put you in a higher tax bracket. Do you have any, kids or spouses that are going to receive benefits on those records? Are you healthy? Longevity in your family? All these kind of variables. So nobody can tell you 100% for sure when you should file until they know more about you. And then even then, it's a crapshoot. You just make your best. If you know exactly when you're going to shuffle off your modal coil and leave us, then that's when we know 100% when you should have taken your benefits. But then it's already too late. Kevin, sorry about the phone issues yesterday. You give good. Oh, okay, yeah, Kevin, I am going to call you today. We had some issues. So many people that set up private appointments with me, they do the smart thing and they put super, super protection on their phone from all these crazy telemarketers. And Kevin had super awesome protection on his, and I couldn't get through to him. So I will we'll try again today. So yes, stay away from those telemarketers. And that's another good thing. I forgot. I guess that's number 8 on Medicare changes for 2025. CMS has finally listened. CMS and the FCC and the FTC, I kind of think they joined together and they said, yeah, these Medicare telemarketers that are calling you up, 20, 30, 40 calls a day, enough already. So they've made it now that basically starting October 15th, and I think they're delaying it a little bit, but it's supposed to be a 1-for-1. So if you tell someone to call you, like you call me or email me or click on that little button, then that's it. My team is the only people that can call you. But what's happened up until now is you go into a Facebook ad or something like that, and it says, "Hey, I need Medicare help." Oh, there's a $20,000 food card and free ice cream and unicorns. And so push this button, and you push this button, and then it goes out to every Medicare insurance agent in the country, and they all start harassing you. And but you didn't tell everybody in the country to call you. You called that you told that one person to call you. But up until now, everybody could call you. But when this new law finally takes effect, they can't do that anymore. So that is a beautiful thing. And those commercials, the football players and starship captains and all those guys who advertise, kind of a bait and switch type thing where they take the best Medicare Advantage plan in the country that has, $5,000 of dental and whatever, they advertise it to the whole country. You can't do that anymore. You can only advertise things that are available in that specific area. So if you've got, $5,000 of the dental in Paris, Texas, you can only advertise it to Paris, Texas. You can't, advertise it to Homestead, Florida or something. So, hey, people in Florida, hopefully everybody's okay in Florida. I know how it is. My family's home was destroyed in Hurricane Andrew. So yeah, it's rough. So hope everything's okay out there. My Part D are calling me to have a colonoscopy, 59 days in a few days. Yep. So yeah, that's Part D. I don't know about your Part D. I don't think that Part D would get involved. Probably your Medicare Advantage or something like that, which yeah, preventive maintenance. Yeah, yes, definitely, definitely. What if you at this moment would never make the deductible, never mind the 2000 cap? We are forced to buy Part D. It's cheaper for me to just use GoodRx. I don't have a med list. Yeah, that's what a lot of people do, unfortunately. And if that's what you want to do for the rest of your life, then more power to you. You don't want to sign up for Part D because you hate prescriptions and you will never take prescriptions. But the repercussions is if you ever change your mind and you need that Part D, then you are going to be penalized 1% for every month you did not have. And you say 1% of what? 1% of, they do this weird calculation, 1% of the national average of a Part D plan, which is about $36 or something. So you're going to pay 1% penalty for every month you did not have Part D. So if you're going to sign up for a Medicare supplement standalone plan, you also need a standalone Part D plan. So you just pick the one with the cheapest premium. This year there was a bunch out there with like 0 per month premium, 50 cents, $1 premium. But those are not, that's not going to happen in 2025. So if you've got a 0 premium Part D plan, you probably already got the notice that your premium is going up. So yeah, that was a quick, what do they call it? Psych. It's like, 0 premium. Okay, well, never mind. Yeah, now they're going to increase it. So you definitely need to check that out. Kimberly, I'm on SSDI, getting widow's benefits. If I see, a lot of people out there. Kimberly is smart. She knows she can get Social Security disability insurance, keep her Medicare, and get survivor benefits on top of her SSDI, and her disability doesn't stop, her Medicare doesn't stop. So she can have those 3 things together: Medicare, disability, and survivor benefits, Medicare, disability, and spouse benefits, Medicare, disability, and divorce spouse benefits. So Kimberly is an exception to the rule. Unfortunately, too many people out there are not getting those extra benefits because they think their Medicare and everything will stop. But Kimberly is super awesome like that. She's good. If I do the ticket to work, get a job, can I quit the program, keep my job, and put in for retirement while working at that job? Absolutely. The ticket to work, yes, they can help you transition to work, because Social Security likes people transitioning to work, get them off the disability, and the people are happier getting to work and make more money. And then, later on, you just file for regular old Social Security benefits, and your prior periods of disability have no relevance whatsoever. So if you're receiving, 20 years of disability, and then you go file for regular retirement at, 65 or 67, you're like, I wonder if there's any more money in the kitty there. No, there's 0 relevance whatsoever. So you just start retirement just as regular old retirement. So hope everyone's having a great, fabulous Friday. Yes. I signed up for your consultation. Haven't heard anything yet. I've called every single one. So if you're in the future here, not baby crab cakes. I don't think I recognize anybody like that. But yeah, if your appointment's today, I will call you after the live Q&A. All right. I asked my sis if she got her ANOC. She thought it may have arrived by mail, email, but wasn't sure. That has always come in snail mail, almost always. I don't think, yeah, I think it's, they may do it twice. But yeah, I think it's regular old snail mail. I really was to make sure she reviews it. I just about 3 minutes ago, I got an email that one of the major companies isn't sending it out until October 1st. So she has that one. Yeah, they should send it out in September. It's like October 1st, with snail mail, you won't get it till the 7th or. Yeah, they should really send it out in September. But um, even if she hasn't got it, if she doesn't get it in time, well, she should have time because the new plans come out October 1st. You can make a change. You can start making changes, switch Part D or switch to Medicare Supplement or switch from one Medicare Advantage to another Medicare Advantage starting October 15th. And you have until December 7th. Terrible day, D-Day. But anyway, you have until December 7th to make that change. But this year is going to be the craziest year in probably since day one because there's so many changes for 2025. So it's important that you schedule, you get with someone that's going to help you out. So if you didn't get your ANOC, Medicare insurance agents and brokers and everybody has your plan available online that they can use to compare with all the other plans available in your particular area. So yeah, again, email me and say, hey, Ed, put me on the lists for October, and we'll have our people contact you and set you up. Can you tell us how much Medicare B will cost per month in 2025? They're estimating 185-ish, but that's just an estimate. We're not coming out with they haven't come out with the new COLA and the new annual earnings limit and the Part B and all that stuff yet. But that'll be soon. And when it comes out, I'm going to do videos on that, but everybody does videos on that. But I'm going to give you kind of the inside scoop to make sure you're getting everything you're eligible for. And all of the details, all the stuff Social Security employees should have told you when you signed up, but they don't have time, unfortunately. Yeah. Will you help me with a new plan? My extra benefits are not taken anywhere. They are getting wasted. Yeah. Yep. Email me or click on that little QR code there, and absolutely we can schedule you an appointment. My wife passed away 4 years ago. I'm on Social Security disability, and she was at the time. But when I turn 67, will I be entitled to some of her income, even though I am a higher earner? No, if you're a higher earner, if your benefit amount is higher, then yeah, unfortunately, there's no more benefits. Hopefully, you got that that $255 lump sum death payment benefit if you were living together. Yeah. But if your benefit amount is higher, then unfortunately, yeah, there's no more benefits there. But remember, you turn 67, so you're basically no longer on disability. When you're on disability and you reach your full retirement age, your benefits are automatically switched from disability benefits to retirement benefits. The check stays the same, the direct deposit stays the same. Most people don't even recognize the switch. But now you're free. No more worrying about, disability and limitations on work. If you can work, it doesn't matter anymore. There's no more continuing disability reviews. So you're no longer technically on disability for Social Security. You're on regular old retirement. So you can do whatever you want. And you don't have to notify Social Security unless you move or something like that. My husband's full retirement age was 65 and 8 months. He started collecting at 65 and 6 months. I reached my FRA in June 2024. Do I compare my PIA to his current amount as it has increased with COLAs? To see if you're eligible for spouse benefits, you always compare PIA and PIA, which is the primary insurance amount and the primary insurance amount. So not what your check says, that's the MBA, the monthly benefit amount. You want your full benefit amount as if you had waited, that person's full benefit amount if they had waited, 60 PIA. And if one is twice the other, then there's more money in there. Brenda, what if deceased ex-spouse was lost in plane crash at sea without filing, asking for another sis? I love it when people ask for other people. That means y'all looking out for each other. That's what we're all about here. Yeah, I've had cases like this where people just fall off the place of, the face of the earth. Um, and doesn't matter if they have produced a death certificate, then if there's more money available there. So if your sister is at least 60 years old, she can file for just regular old survivor benefits and provide the death certificate. And it doesn't matter whether the deceased spouse filed for benefits or not. So she'll get, if she waits until her full retirement age, she'll get 100% of whatever his benefit amount was, his full benefit amount. Let's see. My husband is 16 years older than me. He took Social Security at 65 and 6 months in 2007. I just reached my FRA. What do we compare? Okay, yeah, I think I just answered that one. You asked it twice because no problem. Vermont Democrat Peter Welch proposed a new law to boost. Oh, okay, yeah, it's one of those. Okay, yeah, it's those happen all the time. It's probably just him trying to get votes and by proposing. Yeah, I 100%. This is, yeah, this has happened so many times, stuff like this, and this is where so many YouTubers out there, get these different, YouTube. Oh, this, one politician somewhere said this one thing, and so it's not law. Remember the old schoolhouse rock there? This is just a bill, and yeah, nothing happens. Should you support it? Yeah, I think 100%. Let's support it. But this is the same thing with stimulus. With any type of stimulus, yeah, don't believe the stimulus things that you see on social media. I will show you an image. This is how you determine whether the stimulus is a reality. As soon as you see this, these are the last several presidents. If you see a president standing in front of an American flag, in front of the presidential seal, saying, "I'm such an awesome person. Here's the money we're going to give you, stimulus package." Until you see that, don't believe all the social media BS out there about a new stimulus package coming, a new money coming. This don't believe it's all just someone trying to get you know clicks and whatever. Yeah, it's people are just wasting people's time. So until you see the president standing in front of the American flag, patting themselves on the back about how awesome they are because they're giving you another $500 or something like that, then just ignore it. Yeah, 1954. It's been $255 since 1954. It's crazy. It's crazy. So yeah, 2,900. I like it. Let's support it. I don't know if it'll go anywhere, but that doesn't matter. We should support it. Chrissy, my husband's job covers my medical. I have Part A Medicare. He retired at 62 and is now 65. March, can I apply for Social Security under his account? And can he apply under mine? All right. So you lost your health insurance from work. So that means you had to go ahead and sign up for Part B. You have 8 months to sign up for Part B to avoid the penalty. I never recommend waiting 8 months because that's when you get sick or fall. So usually about 1 or 2 or 3 months before you're going to lose health insurance from current work, yours or your spouse's, then you go ahead and sign up for Part B, and then you pick, what you're going to do in terms of covering all those gaps, either a Medicare supplement or a Medicare Advantage plan. In terms of your monthly benefits, whoever's the highest. So one PIA, one benefit amount has to be twice the others. So if but you have to file. The lower earning spouse has to file for benefits on their own record. They have to start their money, and then they get the difference between the two up to 50%. Elaine, do you ever foresee the time when you can keep your own Social Security benefits as well as your husband's after he died? To just keep the larger amount doesn't seem fair. Yeah, no, it's been pretty much like that forever. And I've taken hundreds of thousands of survivor claims, and probably about 10-20% of the people are completely devastated and surprised. They have heard, when the spouse dies, you get those benefits, but they think their benefits, continue. So for instance, if one spouse was getting 1,000 and the other spouse was getting 1,500, total $2,500 coming into the household. The higher earning spouse passes away. The lower earning spouse continues to get her $1,000, his or her $1,000, but gets an extra $500, the difference. So the surviving spouse gets $1,500. They've essentially lost $1,000 coming into the household. Way too many people don't know that, and they don't plan that. Essentially one check, it's devastating. So we really need to get the information out there of how that calculation is done. So yeah, so people can prepare for it. But I don't see, I mean, Social Security is, the trust fund is going to run out in what, 8, 9 years as is, and politicians, are just trying to kick the can down the road to create even worse emergencies so they can do drastic measures. So that's why it's our job to make sure they do something now. What the other way? Let's see. Okay. I was getting my husband's death. I was on OWCP until I retired on civil service. Was told didn't have the points to receive it. Yeah, so people that worked for the federal government under the old system didn't pay into Social Security. Yeah, so let's see. How do I cancel my Advantage now that I have a supplement plan? Well, if you have a supplement plan, you can't have both. It's illegal to have both. So your Medicare, if you signed up for a Medicare supplement plan, switch that, then your Medicare Advantage should have already been automatically canceled. I have used my supplement plan, but still billed on my Advantage plan. I am paying for supplement. Yeah, that shouldn't have happened. So again, another Medicare insurance agent not doing the right thing or something, messing something out. So yeah, that doesn't sound right at all. You need to call the Medicare Advantage plan. They should have already been notified through Medicare and everything. Yeah, that's kind of illegal to sell someone a Medicare supplement plan that already has a Medicare Advantage plan. And maybe, yeah, I can't figure out. It's, people sign up for a Medicare supplement plan, in October, November, and it's effective January 1st because your Medicare Advantage, you can't get out of your Medicare Advantage because those are a year contract unless you move or something like that. Yeah, then, your Medicare Advantage automatically doesn't renew on January 1st, and then your Medicare supplement plan starts on January 1st. But in your particular case, if you have two, that's not right at all. So you need to reach out to the person that signed you up and say, hey, what the heck's going on here? You screwed it up. So there's that. Let's see here. What if you have to take disability due to an accident before you were 62 because you were unable to because of work? Yeah, disability. Actually, I'm doing a video tomorrow on disability, whether you can get disability for whatever disabling condition. So yeah, after 4 years with the Air Force civilian, I've been medically retired. Can I hire you to do SSDI? No, I don't do. I don't represent people for disability claims. And for the first couple of stages, I've done a couple of videos that explain how to file and all the tips, tricks, and secrets. So for the first couple of stages, the initial and the reconsideration, you can do it yourself. It's super easy. If you want a lawyer, go for it. I'd highly recommend a kind of a local lawyer that knows the local judges. Because the third stage, yeah, I recommend a lawyer at the third stages. Do you have to do taxes on Social Security retirement? I just did a video on that about a week ago. If all you receive is Social Security benefits, then you probably don't pay taxes. But if you receive your Social Security benefits and other income or distributions or something like that, then yes. SSI and SSDI have been trying to take my money. They even took my Angel Ins there. Yeah, SSI is the welfare-based program. You can receive SSI and SSDI. Yes. Do you know about railroad retirement? Yes, I've taken hundreds, not probably taken thousands. And it basically Social Security, just if you come in and say you work for the railroad, then Social Security has to call the railroad board. We used to call the one in Mesa, Arizona, and find out who has jurisdiction. So if you've got more in the railroad board, then we just say call the railroad board. If the railroad board says, oh, no, you got jurisdiction, then Social Security does your retirement claim or spouse claim and all that kind of good stuff. All right. Let's see. Can't thank you enough. Divorced spouse, 3 phone calls to the Social Security office. Nice people. Good. Getting a year of back pay and almost double my disability income. My man. All right. Bobby got some money. We like it. And again, I always say, this, I'm just, some guy sitting here giving you all my decades of experience. The reason you got that information is because all of the people before you shared and liked and subscribed and all that kind of stuff. That's how the information gets out there. So this is a team effort, and the team got some money for Bobby. All right, everybody pat themselves on the back. Received ANOC via email, requested a copy. Okay, so now they're sending some out on email. Okay, all right, good to know. Yeah, I don't like the email thing because you people goes into they think it's an official email, and it's I know companies out there, scamming companies, are going to send you emails that look like the annual notice of change, and then you're going to click on it and download some virus or something. Yeah, I think old companies are trying to save money. So Cindy, turning 65, approximately 3 months. Some say I don't have to have anything besides Medicare because I'm still working, and some say I have to take a plan A or B. I also heard of plan G. Can you help me? Absolutely. So you don't have to start your money if you don't want to. If you're working, making over the $22,320, and so $1 for every $2 you go over, you just want to wait till you're full retirement age. No problem. You do not have to take your monthly benefits. You can sign up for just Part A. In terms of Part B, if you're currently receiving health insurance from work, your current work, yours or your spouse's, and that employer has 20 or more employees, you don't have to sign up for Part B either. So in terms of Part A, you can if you want. It's the monthly premium is free. It might help because maybe the Part B deductible for if you have to go to a hospital next year is less than your private plan. That's what I see happen sometimes. So they, might be a good idea to sign up for Part A. However, you don't have to do that either if you don't want to. If you have a health savings account that you're contributing to, you have to stop contributing to that health savings account 6 months prior to sign up for Part A. But in your particular case, if you got health insurance from work, 20 or more employees, you're happy with it, don't have to sign up for Part B, don't have to sign up for money if you don't want to. You can sign up for Part A if you want, but if you don't want to, then don't. If you want to go ahead and sign up for Part A, just call the 800 number, schedule an appointment, or just go ahead and file online and then say, I want Part A, I don't want Part B, I don't want money, and they will just start your Part A. And once you stop working and stop receiving health insurance from that work, then you go ahead and sign up for Part B. And you can just sign up for Part B at that time and say, well, I still don't want my money. Or you can sign up for the money at your full retirement age and still delay getting Part B. So you have all kinds of different options. And then in terms of the Plan G, once you sign up for Part B, then you have to find a plan that's going to cover all those gaps of original Medicare. And Plan G, if it's in your budget, yes, 100% all day long. Plan G, Plan N, either of those is an awesome bill. Okay, let's see here. My husband of 35 wonderful years has dementia. Wow. Sorry to hear that. But is not a safe discharge to home. So currently he is in a nice memory care facility, but I am paying for it out of pocket. $8,900 per month. Oh my gosh. Yeah, Medicare and all those, long-term nursing facilities and stuff like that, they don't cover that. That's why some people, they as long as you have assets, the state Medicaid won't help out. Once you lose all your assets, all your cash, um, then Medicaid will take over. But they can eventually come after your home. So if your intention was giving your home to charity or your kids, same thing. Anyway, then if you use Medicaid money, Medicaid could come after your home. That's why some people put their home in an irrevocable trust, but that has to be done 5 years prior because most Medicaid, I think all Medicaid offices throughout the country, there are some that have what's called the Lady Bird law that protects that. But Laura, can I schedule an appointment with you? Absolutely. Yep. So you just go on to the description on my website or the description at the bottom, um, and you click on the extra help, and um, it says one-on-one private consultation. And yep. And again, I do charge for that. 99.9% of my help here, and then my Medicare team's help is free, but I do charge for the one-on-one to pay for everything else. Brenda, I just have to say you rock. I would never have applied for SSDI without your encouragement. I listen and learn almost every night. Awesome. Good deal. Another team. We're just killing it today. I like it. I like to hear more stories like that. I never got my ANOC, but am on your list for brokers to call. Awesome. All right. Good deal. Hey, Jeffrey, what's up? Blessing sign up for all day. Yes, yes. Unless you're giving to that HSA. And Social Security employees don't really, you go in and say, I want to sign up for Part A. They sign up for Part A. Quite often, they don't tell you about the whole health savings account thing. And then because that's an IRS issue, you're getting, tax benefits from the IRS because of an HSA. So Social Security employees don't know taxes like that. So often they don't tell you. And then people get jammed up with the IRS. So they have not automatically doing it. Spent hours on trying to cancel. So if illegal, how do I propose this? I turned 65 in July. Oh, okay. So you're the one that has Medicare Advantage and a Medicare supplement. Yeah, they're not supposed to tell you when you do that thing. When you sign up for a Medicare supplement, they specifically supposed to ask you in the application, do you have anything else? You have a Medicare Advantage, and then they say, well, okay, you understand that you can't have both, and that the other one has to be canceled. Yeah, I don't think it's automatic. It's automatic if it's done at the end of the year because that's when your new Medicare Advantage renews. And once Medicare notifies the new Medicare Advantage that you switch to a supplement, then it doesn't automatically renew. So it depends on what time of the year you did it. Yeah, but yeah, you definitely need to get that figured out. I was a 9/11 first responder. Wow, and have cancer. Oh my gosh. I have Social Security disability. He has Social Security, and I am able to collect from his union pension. Is there any aid available for my situation or no? Medicare denied payment because of Minta. Um, So yeah, his union pension has no effect on your Social Security. Doesn't have no effect on his Social Security. So that's completely different. Any other situation? No. If you're receiving SSDI, um, if your husband is currently receiving Social Security benefits, if his full benefit amount is twice yours, then you definitely need to file for spouse benefits. Doctor, I received a call from your team today about putting me on the list for Medicare. Just want to say thank you. She was very nice. Oh, awesome. That was probably Megan. She is awesome. My husband is 71, and we got a letter saying the Medicare Advantage will not be renewed. Oh, yes. Millions of people are going to receive that. So these Medicare Advantage plans, there's a couple of big companies that you all know the names. I always like to stay neutral on this. Um, that are going to be dropping 10% of their people, 10% of their customers, because they're reconsolidating. They're like, we're only going to focus on areas that we make tons of money on. So if you live in, let's say, Phoenix, um, big metropolitan area, you're probably good. If you live in, let's say, Casa Grande, way, way down in the desert, then yeah, probably not so much. Because the companies are like, yeah, we're making a little bit of money there, but yeah, not enough. So let's focus on the places we make tons of money. So millions of people are going to be losing their Medicare Advantage plan. And those people that have Medicare Advantage plan, even in big areas, they're going to be downgrading the benefits. Um, Across the board. We're not 100%. Sometimes your benefits might increase, but yeah. So, but there's a lot of other plans in your area, so you should definitely check all your options. Because again, can't say this is enough. This is your money. You know, you've paid it. That's your money sitting in there. Go get it from those. Because if you don't keep it, if you don't get it, then the CEO and the board of the directors, they're gonna take their $1 billion golden parachutes, and you're like, well, that was my money. You should have got it while you got it, how you had the chance. So yeah, any suggestions on you is you have to switch. And this is good. This is awesome. This is really, really good. If it's in your budget, if you're essentially being abandoned by your Medicare Advantage plan, that sets you up for a special enrollment period. So if you really wanted a Medicare supplement plan like the Plan F or G or whatever the case may be, but previously, you wanted it, but you set up for Medicare Advantage and then you change your mind, and now you can't get a Medicare supplement because of whatever health issues or whatever. Now, guess what? You're in a special enrollment period, and you can actually switch to a Medicare supplement plan without health underwriting. So some people are very, very happy. Some people are going to the post office, their post box every day and say, please cancel me. Please cancel me. I want to get out of Medicare Advantage. I want to get to a Medicare supplement, but because I had a heart attack, or I have, type 2 diabetes, and I take too much insulin, I can't get one. But if they deny me, please deny me. Please cancel me. Please cancel me. And as soon as they get that cancel letter, save it, because the Medicare insurance person that helps you find a new plan and get you signed up with Medicare supplement, they're going to need kind of a copy of that letter that shows that you have the rights to a Medicare supplement plan. So yeah, a lot of people out there hoping they get canceled. I think that's a unique thing. Please cancel me. Anyway, Dr. Ed, my husband passed away 3.5 years ago, and he never got benefits. He was 63. I am 60 years old and on SSDI. I'm thinking applying for survivor benefits. Will I lose my Medicare? No, you will not. You will not lose your Medicare. And that is the unfortunate thing about all of this. There are thousands, tens of thousands, hundreds of thousands of people out there in your specific situation, exactly your situation, that have extra money coming to them, but are afraid they're going to lose their disability and therefore their Medicare, because they're not 65 yet. No, you are good. Please call Social Security immediately and find out how much the benefits are going to be. Obviously, you're taking at 60, so they're going to be reduced. You're going to get 71.5% of his full benefit amount. But that will be added above and beyond your current disability benefits. So you'll get disability, Medicare, and survivor benefits. So please get those benefits. Yeah. And again, every month you wait, you'll get more money. So you can ask, okay, what if I wait a year? How much more is it going to increase, and all the rest of it? But yeah. Vanessa, have you looked into Medicaid? Yes. I forget who Vanessa is, but anyway, yeah, Medicaid. Another thing, people don't realize that they can have Medicare and Medicaid. And if they get Medicaid, Medicaid can pay for their Part B premium. So if you know anybody, you know somebody that's having a hard time paying that $174.70, please tell them to call the state social services Medicaid office and apply for Medicaid and say, hey, please pay for my Part B. And they'll pay for the Part B, and you'll be dual eligible, Medicare and Medicaid, and you can get those Medicare Advantage plans called dual eligible that have all the extra benefits. So definitely, there's so many missing parts out there that people are missing. So that's why I'm here in my semi-retirement. My retirement lasted about a week. I was told by the Social Security office that I could not receive SSI if I am already receiving SSDI, but I just heard from your live broadcast you can get both. So how do I get both? Yes, it depends on how much your SSDI benefit is. If it's over $943, then no, you cannot get SSI. So people can get SSI if their benefit amount is less than that. So if you're getting $500 from SSDI, you can get another $443 from SSI. So you can have both. But that SSI is a welfare-based program, so obviously, if you're only getting $500 from SSDI, but then you have $20,000 401k, then you're not going to be eligible for the SSI. But if you don't have any other income or resources, 100% apply for SSI. So you can have SSDI and Medicare, SSI, and because you have SSI, you're categorically eligible for Medicaid from the state. You get Medicaid from the state. The Medicaid from the state pays for your Part B premium, and then you get the extra help with prescription drugs, and then you get a Medicare Advantage dual eligible that gives you all the different benefits, a grocery card, and pays for a part of your rent, or depends on what's available in your particular area. So yeah, it's just way too confusing, isn't it? So, but there is help out there for a lot of people that need it. All right, Sue. If you are receiving survivor Social Security benefits, if you start at full retirement age, do you receive more than if starting at 65? And then can this be adjusted if this is true? Conceivably, yes. But that's why I always say survivor benefits are difficult because it depends when your deceased spouse received benefits. If they started receiving benefits early, then there might not be more money if you wait after 62 and a half. There's this thing called the widow's limb, the widow's cap, the rib limb. It's all the same thing, but there's different calculations. So the best thing to do in your particular situation, if your deceased spouse never received Social Security benefits, or they received disability benefits, or they collected benefits at their full retirement age, basically, then yes, your benefits will increase the longer you wait. And then once you hit your full retirement age, you'll receive 100% of their benefit amount. And then their benefit amount also is different if they filed after their full retirement age. You won't receive 100% of their PIA, their primary insurance amount. You'll also receive those delayed retirement credits. And even if they passed away before filing, if they passed away at 69, you will get the little delayed retirement credits as if they filed at 69 years old. See how crazy it all. So here's what I recommend for survivor benefits. Call Social Security and schedule an appointment to take a claim. You don't have to do the claim. You don't have to adjudicate the claim. You schedule an appointment with Social Security and tell them you want to file a claim for survivor benefits. And then you say, okay, if I start the benefits amount this month, how much is it going to be? If I wait until next year, for example, how much is it going to be? And it's super easy for them to do. They just do in MCS, they change the MOE, the month of entitlement, and it takes them 2 seconds, and they'll tell you, oh, okay, if you wait till next year, it's not going to increase. That means there's a rib limb involved in there. But if they say, oh yeah, starting next year, it's going to be this much more, then you can make your decision. And if you're said, okay, I'll come back next year, and then yeah, they will be very happy because they didn't lose a sale. They're like, oh, okay, now I can go work on that other 1,000 cases at my desk. So Schoolhouse Rock, it's just a bill. Did on Capitol Hill. Yes. I love those Schoolhouse Rock. When I started getting my SSDI benefits, I applied for Medicare as well, but I did not do the drug plan, and now I am paying a small monthly fee for my scripts. How do I get that fee dropped? Unfortunately, if you delayed, you get that penalty for not signing up for Part D when you were supposed to, or Part B when you're supposed to, then yeah, you can't get it dropped, unfortunately. Unless you apply for Medicaid and Medicaid pays for it, then you don't care if it's dropped or not because Medicaid is paying for that, Part B and Part D and all that kind of stuff. So there's that. Let's see. I have fought SSI and SSDI, won one case, and still haven't heard from my other case. They take $90 out. So, okay, so you won your disability claim and you got proof of disability, but it sounds like they somehow taken $90 out for an overpayment or whatever the case may be, you filed a request for reconsideration for them to reevaluate that, and you haven't heard back, then yeah, Social Security is understaffed, the worst in 50 years. So it takes time, but not sure how long it's taken. But I would call them up and say, hey, what's going on with my other request? And if you don't get any satisfaction from your local office, then you might have to reach out to your congressional representative. Most congressional representatives, state, not the state ones, but the federal ones, the ones that go to Washington, D.C., your congressperson, your senator, they have on their website a little button that says, I need help with a federal agency, and they can help you out. All right, we are out of time. Let me find one or two people that I've never seen before. I also do pay taxes on my SSDI, and this is my only income, but heard here I do not have to explain. Yeah, if I just did a video on taxes, and in that video, so look in my website and go and click on live. Most of my videos are live, and then check out the one on taxes. And then there's a link on there too, an IRS website link. Actually, I'll put it here as well. And then it'll tell you, it's a nice little tool to see if you should be paying taxes on your Social Security. Obviously, you're going to pay taxes on other stuff, but in terms of paying taxes on Social Security, this will tell you how much taxes you will be paying on your Social Security. So I just put it in the comments down there. All right. Let's see here. If you start working and take their health insurance, can you stop your Medicare insurance? If you do, you will be penalized at that time. No, if you stop working at 65 and start taking Medicare insurance and stuff, and then a year, 2 years later, you get a job that you work for for years, and you have health insurance from that work, then you can go ahead and stop your Part B, save yourself the 174. You can't stop Part A, but that's free, so why would you? All right, that is it. If I didn't get to your question, I apologize. Ran out of time. I will be back tomorrow. Tomorrow, I'm going to be talking about disability and what you can, your disabling conditions and disabilities. So, and then I'll do a live